Σας ευχαριστώ πάρα πολύ για την πρόσκληση και σας ευχαριστώ επίσης που μου επιτρέπετε να μιλήσω στα αγγλικά, γιατί θα μιλήσω σήμερα για την έρευνα του διδακτορικού μου, που μόλις πριν 10 μέρες βασικά πέρασα και την εξεταστική βάιβα. Αλλά θα αποφύγω να κάνω τη μετάφραση, γιατί στη μετάφραση θα χαθεί και κάποια ουσία, οπότε θα σας μιλήσω στα αγγλικά. Θα μπορώ να δεχτώ στο τέλος ερωτήσεις στα ελληνικά. I need to start with putting a context around this research. I'm a psychosexual therapist that has been practicing in London since the late 90s. And my last employment in the National Health Service in sexual health and HIV was based in a well-known gay-friendly neighborhood. Some of you will know it's called Soho. So I was managing quite a busy psychosexual service, and naively I assumed that just because I was based right in the center of London, we will no longer see issues between sexuality and religion. But what I noticed in that employment was that quite a number, specifically gay men, were coming for sexual problems, such as, I don't know, erectile dysfunction or problems with ejaculation. But at the core of their issue was the difficulty to accept themselves. And this was specifically around religious upbringing. These cases kept coming up. And I was faced with a dilemma of what can I do beyond the consultation room, beyond the one-to-one therapy. Right next to the sexual health clinic where I was working was a church, Church of England. And one day I went and I knocked on the door of the priest. And this is the priest in the picture, Reverend Simon Buckley. I introduced myself and I told him what I had observed through my clinical practice. And I wondered if there was something we can do together. He was very welcoming. He was very open to the idea. And he said, this is why we're here. So very, very slowly and initially quite carefully, we started what turned out to be a pilot version of collaborative workshops between myself and the reverend, the priest. So gay religious men initially turned up to the sessions, and each session used to explore a different topic that was important for the men who attended those workshops. I approached the topic from a sexual health, psychosexual, psychology perspective, and the priest will approach it from a religious, theological, Christian perspective. We would facilitate a conversation between ourselves and the participants, and usually the session would last about 2 hours with a small break in the middle, and we will end with a little prayer or meditation. After delivering the pilot version, and with very positive feedback anecdotally, I wanted to understand this further. And that's where this research is about. This is a qualitative methodology study, and it's phenomenological in its nature. So the research question that I wanted to focus was, what was the experience of gay Christian men attending collaborative workshops facilitated by a sexual health professional and the church. So I wanted to understand, what was it like for those gay Christian men who attended workshops where both a representative from their religion and a representative of their sexuality were equally in the same place in the venue of a church. So I wanted to understand, and these are the sub-questions of the research, I wanted to understand what was the influence of those collaborative workshops and what factors were either barriers or predictors of such influences. So this was the research question. Again, very naively, oh, sorry, I think there is a hand raised.
Όχι, όχι. Κυρία Κουνελάκη, είναι για τον επόμενο μιλητή.
Okay, fine. So again, naively, I thought it will be very easy to recruit for this study, but I found out that even in a place like London and central London, this was still a hard to reach demographic. So this is the final sample of 11 men. And as you can see, it's a mixture of denomination. I wanted to be open to the possibility of having other denominations. I didn't want to assume that some denominations are feeling easier with this religion and sexuality concept. And the workshop themes, so we delivered 6 workshops. When we co-delivered open evenings for the recruitment, and within the open evenings, we gave a short presentation of what the collaborations were about and some of the experiences from the pilot study. And then we asked the men who attended the open evenings, what would they like us to explore through the 6 sessions? And these were the 6 main areas they wanted us to concentrate on: being a minority within a minority, shame and guilt, the interrelation of sexuality and religion, the coming out process, sexual interactions between gay and Christian men, and lastly, integration and authenticity. So 6 sessions were delivered between March and September 2018. Those were all very important topics, but in all honesty, we could have done all the sessions on the topic of shame and guilt. The methods are used for the study to understand the experience of attending such collaborative workshops were one-to-one interviews at the end of the series of 6 workshops, where the participants came and found me in a time that was agreed and it was convenient to them, within the clinic, within the privacy of a consultation room. Whilst they were about to attend that one-to-one interview, I asked them to consider their experience of attending the collaborative workshops with an image. Immediately after each workshop, I asked the participants to capture their experience with a short poem in the format of haiku poetry. For those who have not heard about haiku poetry before, haiku poetry is a Japanese method of writing poetry in 3 very short sentences. It doesn't have to rhyme. It's a way of describing how you experience this moment. And it is in total 17 syllables. So the qualitative analysis I then considered was thematic analysis of each method, interviews, textual description of imagery, and haiku poetry. So each individually analyzed, and then I looked at the overarching themes that came through. You can appreciate it was a mountain of data at the end. So I summarized here the themes that came up at the one-to-one interview analysis. The main themes were motivation, self-development, and the influence of the environment. So what I found out in terms of motivation is the ones that were the participants who were open to receive from the messages of the collaborative workshops overall experienced them more beneficially than the ones that came with an urgency to be validated and accepted for their sexuality. There was a lot around self-development. So what kept coming up is that the experience of the workshops, of attending the workshops, had an impact on them, on themselves, on their self-development. For some of them, it was a positive self-growth, and for some of them, it somehow reminded them how hopeless that was. The ones that were hopeless still throughout the workshops were, interestingly, and in line with the rest of the literature, more likely to identify with more conservative denominations, such as Roman Catholic or Pentecostal Christians. There was a lot about the influence of the environment. There was something very, very powerful in the physicality of being within the premises of a church in the center of London. A lot of human dynamics were played out throughout the workshops, and what kept coming up was the sense of safety. I've got quite a few quotes from the participants. So this is specifically around motivation. I'm going to choose one of each to read because otherwise there might be quite loads. I would say what's good about this workshop, that first of all, you meet other people, which doesn't happen very often, and especially if you're not out. And the second one is also quite a good one. Because I had problems with shame about my sexuality, that is one of the reasons I came to this group. If I had not felt shame and guilt properly, I wouldn't have bothered. The self-development theme, one of them is, I'll read the second one. By not being out, I feel I'm betraying people, even if it's my life. I'm not helping the gay community. And in terms of the influence of the environment of the workshop, it just felt validating that I identified with a group of people who I felt are very marginalized, and there was a space for me to go. I felt part of the community very much, and I haven't felt like that within the gay or religious community for a while. I felt accepted and didn't feel any less important than anybody else. I'm not sure you can see very clearly, but these are the images that were brought to the interview schedule. And I considered them to be a reflection between the end of the collaborative workshops and the interview schedule. So there was a bit of time to reflect on their own, in their own time, what it was like to attend such workshops. So there were three themes that came up: feeling validated, level of connection, and feeling nourished. I don't know if you can see them quite clearly, but some of them are quite striking, and I'm going to go into giving you a bit more examples of how they identified with them. So this one is one that the participant actually drew himself, and what he's showing here is himself at the beginning of the workshops. And this is himself at the end of the workshops. And what he has done is he has put the months of the workshop and how his mood changed towards the end. And he said, I put myself, this is the beginning, including what my feeling and what I thought of my idea of religion. So this is, I called ignorance and hypocrisy. It's like you climb. It was like going to the session. It was doing something different every month. This one, it was fascinating because, I mean, we don't have these sweets, I think, in Greece. Well, at least they were not there when I was in Greece. So they're licorice and they're all mixed up, different flavors all together. So he brought this as an example of his reflection of attending the workshop. And he said, the thing about those sweets, they are all different. They are not all the same as some packet of sweets. And it struck me that it rather symbolizes the men in the group. Every man was different. You had young, old, oriental, black. Some talked a lot, some didn't talk, some had different behavior patterns, some arrived early, some came late. This was a picture brought from someone who felt quite nourished from attending the collaborative workshops. I would probably go straight into something in nature, like a flower. That sort of, it's doing fine, is standing on its own, but maybe it's nourished a little bit, lifts its head a little bit. It's the best way I can describe. It gets more of something that it needs, a bit more sunlight, a bit more things that it needs to grow. That will be the metaphor I will use. And finally, this is the analysis of the haiku poetry. And there were two main themes that came up: possibilities, and again, the environment of the workshop. And you can see how this is sort of running through the three methods of analysis. In terms of possibilities, I want to give you some examples because they're short of what the participants wrote in their haiku poems. The end and yet more. So much has passed and yet more. Fruit, nuts, seeds will come. Caught committing a sin, embarrassing a relative, disappointing my mum, hiding to survive. In terms of the environment of the workshop, these are some of the examples. Nerves, usually brave, shaking, sharing my system as the guard comes down. Living out, come out to the living. To be alive is to be. Do not hide your life. So I had to, obviously, at the end, start putting it all together. And you can appreciate the analysis took a few years because of the different methods that were used, but also by the sheer volume of data I had accumulated. I was very lucky that the workshops were completed and data collection was completed before the pandemic. So I spent most of the pandemic time lockdown analyzing. So what kept coming up was, and going back to the research question, was the environmental factors and the personal factors. But in terms of the influence of the workshops, were on two levels, either on the self-perception of the participants or on their relationships. So again, this is the answer to the sub-questions, as I just mentioned. One of the things that I put forward as a result of the findings is an adapted look to Maslow's hierarchy of needs. Maslow's hierarchy of needs has been adapted a few times, but what I found in literature, it's been adapted mainly for palliative and emergency care in hospitals, because it's obviously is all about human needs. Now, although there was, if you think about it, there was nothing urgent, there was no emergency in the treatment of the gay religious men I was treating in the clinic. But what I picked up was a need. And the need was to somehow integrate their sexuality with their religion in a way that feels right to them. So on the left side, you can see the original Maslow hierarchy of needs, which is written quite a while ago, in early 40s. With my findings, what I put forward is that the need to be free of shame for this specific demographic of people, participants or clients, before they can feel belonging, connection, and love. And in many ways, that reverses the order from the original Maslow, and the importance of a safe environment to do that. Well, and going back to the results, I found that some people did manage to go all the way to the place of authenticity in their experience, having attended all 6 workshops. But some of them were so full of shame and regret for not having come out, for not living their life to full honesty, that in many ways they could only come until a certain point to the pyramid. But they still stayed within the collaborative workshops. They attended and they were committed. The limitations of the study, I mean, there are quite a few limitations, but the main ones I want to mention here is that this was a self-selecting study. And as a result, there were a lot of gay Christian men who I was unable to access, to invite to the workshops. These workshops run in central London, so it was, you know, again, they were open to those possibly that could travel to central London, as opposed to those who would be living in much more rural areas and they wouldn't be able to travel, or they couldn't afford it. It was a study and a workshop that was provided face-to-face. So, you know, it would have been possibly different if it was hybrid or if it was all online. The other thing about the limitation of the study is that the way I understood, I interpreted, I discussed my findings are mainly from a perspective of a psychologist, and I'm not a theologist. In fact, I make it very clear in my thesis on my reflective piece that not only I'm not a theologist, I was the only woman, cis woman of the group. I don't identify as gay and I don't identify as Christian. So I brought all that difference within my discussion. I identify in many ways as a religious and ethnic minority. I'm a Muslim Greek. I belong to the Muslim minority of Greece. So I talked about my understanding of being a minority myself and how sometimes it felt quite comfortable being there amongst gay Christian men. The recommendations I have made, I mean, this is again, very few of them, but I make a recommendation for further collaborations between sexual health clinics and religious establishments. Religion and spirituality overall, I've felt for years was the last taboo in sexual health clinics. It's almost like health professionals don't want to touch it, don't want to go there, don't want to ask. But then again, I realized that we're missing out as to a big part of the identity of some of the patients. Both religious and sexual health representatives need to be up to date about the needs of LGBTQ plus communities. And I put forward the case of this study to be established in much more multi-centered collaboration. So we can then have the higher numbers in samples, so we can maybe even consider measuring the impact of such collaborations. Thank you very much.